My first experience with Eye Care Associates occurred when I joined the Canes organization, which I was actually surprised to know that the team was associated with an eye care specialist. In previous teams I played for, that wasn't the case. And my first interaction was a training camp where a team of staff and doctors are there, and it put us through some rigorous eye tests, if you can call eye tests such. But it was a great experience. It was, top of the line treatment for training camp. Usually they just make sure you can see 20/20 and then they send you out there, but it was much more intensive and much more inclusive. And with that, I was a contact lens wearer as well, and that's when Dr. Peters and I became a little bit more involved with each other and making sure that I found the right contact lens for me, which happened to be not the one I was wearing. I oftentimes during games, you could see me in the penalty box or on the bench with a contact lens in my hand, trying to jam it back in there. Dr. Peters made some recommendations and took some measurements and got me into a different contact lens that was probably a little bit more appropriate for my line of work and what I needed on a day-to-day basis. And my problems went down from there, and it was just regular contact lenses, and I didn't have to worry about them, and that's what everybody wants when you're dealing with contact lenses, to forget that they're there. Well, vision is kind of the unspoken talent or skill, if you will, that often doesn't get mentioned in circles, whether it be you're playing hockey or baseball. How fast you are, or how well you shoot the puck, or how strong you are. How you see is probably the most integral and vital skill to any professional sport playing at a high level. As a professional athlete, we take great care in our eyes and have great respect for keeping them safe and in peak condition in order to do what we do well. And it's no surprise if you look at the statistics. Dr. Peters and I have discussed it on many times, whether it be hockey or baseball or football. The top performing athletes usually always have the best vision. There's such a high correlation between that, and it's no surprise because those who can see can do better. I finished the game. We went into overtime, played overtime. My post-game routine was the same. I went to bed, I slept well. I woke up in the morning, things were fine. But at practice the next day, I noticed that things just weren't right. It was almost as though the background of my world was kind of in a little bit of a kaleidoscope style. Things were kind of moving in the background that weren't normally moving in the background. Information that I would normally inhibit and block out was now highly prevalent in my visual field, and it was giving me headaches, and it was making me kind of nauseous, and things were getting blurry, and I was unable to focus on what was right in front of me. So at that point, we decided that it was time to step back and go through the full concussion protocol. And that's when Dr. Peters and I got together and tried to do some of the cutting-edge visual therapy. First, we came in and ran through the gauntlet of tests, and through his research, what I found was most unique is we noticed that I actually developed an astigmatism in my right eye over the course of the injury, which Dr. Peters has told me through research that's not uncommon. So the first thing was to take the ease off that. I was in a new pair of glasses, although I didn't need glasses for that right away, to try and just alleviate some of that strain on my eyes. And what was amazing about that is in 3 days, the astigmatism had changed and was reduced significantly. And to have that objective result, that measurable, quantifiable result that you can see things are changing in the brain through the visual pathway into your brain, I think is huge. It's something that I'd never come across or experienced in any of my experiences with other players having concussions. Using the prisms, I continually improved, and it was, it wasn't an overnight process. It required, some intense therapy, about 2 weeks, in order to retrain that. But slowly, I was able to reestablish my pre-concussion levels of performance, and have been better for it since. In terms of the care, it was it was 5-star all the way. Not only Dr. Peters, but also his staff, particularly Ashley, were here before the office opened in order to treat me and see to my rehabilitation in the office here. You know, Dr. Peters and I were in here on actually Sundays after church. He would come by, you know, so that means a lot to an athlete when a professional associated with the team and his staff go out of their way and take their personal time to treat you. You know they truly care, and that's the most important part for us to know that people really care about us getting better and getting back on the ice.